Hello, and welcome to today's episode of the GynoBits podcast. I'm your host, Dr. Susie Weber, board-certified gynecologist and menopause specialist. On the GynoBits podcast, we'll cover women's health issues with a focus on menopause, vulvovaginal conditions, and sexual health. Hello, and welcome to today's podcast. If you liked it, then you should have put some estrogen on it. Today I wanted to talk about some vulvovaginal changes that can occur with perimenopause and menopause. This is mainly related to declines in estrogen levels, which can cause thinning of the vulvovaginal tissues, the tissues around the base of the bladder and the urethra. You can also have decreased blood flow to these areas, and in turn, this can produce vaginal dryness and pain with intercourse, bladder changes, feeling like you need to urinate more frequently, dry skin, irritation, you name it. And the old terminology for this used to be vulvovaginal atrophy, but now we call this Genitourinary Syndrome of Menopause. And if you're perimenopausal or menopausal and you have no symptoms or problems, that is fine. You absolutely don't need to change anything if you're doing fine. But if you're starting to get dryness and discomfort with intercourse, nip it in the bud ahead of time because it's not going to get better, especially the farther you get into menopause, or if it becomes painful and you are not having regular sexual activity, it's going to be very hard to get back to normal sexual function after some time. And you don't always need to use local vaginal hormones. You can start out with a lubricant for intercourse or try a vaginal moisturizer. There are a lot of moisturizers over the counter. There are also moisturizers that you can order online. A lot of these have hyaluronic acid in them. Hyaluronic acid is also in a lot of our facial moisturizers. It helps just draw moisture into the tissues and plump them up. But if you're not getting satisfactory results with these measures, then you should really consider getting on local vaginal hormones. And everybody worries about hormones getting into their bloodstream, but these really are local, and 99.9% or more of these hormones will stay in the vaginal tissues. There are very few reasons why a woman cannot use these medications. Certainly if you have had breast cancer or another hormone-sensitive cancer, it's always best to check with your oncologist. The pros to using these medications are that they can increase your natural lubrication and comfort with or without sexual activity. You can have dryness and discomfort in those tissues. You sit on your bottom all day long and you can have irritation. Urination can be uncomfortable. The urine can sting or burn the vulvar tissues as well. And using these local vaginal hormones can keep the vaginal tissues healthy, promote healthy bacterial growth in the vagina. Lactobacilli are the bacteria that try to keep the peace in the vagina and keep you from getting infections. And so keeping a healthy vaginal environment can help reduce your risk of infections. It can also help reduce your risk of urinary tract infections. And like I said, there are very few cons to using these medications. One would be it takes time to apply them or put them in the vagina. There can be a cost. These medications used to be more expensive, especially in the Medicare population. I think there are more insurance companies that are covering these medications to a better degree, and there are a couple of generic alternatives, so those are going to be more cost effective. And then there are also some pharmacies that offer these generic medications at even further reduced costs without using your insurance, like Amazon or Mark Cuban Cost Plus Pharmacy. You can frequently find some generics at a cheaper price than some insurers. And like I said, most of these hormones really are going to stay local, and there are very few contraindications. So what are these hormones that I am alluding to? The first one, and I would say the go-to for most gynecologists, is estradiol. Estradiol is the estrogen, strong estrogen that we make before menopause, and it's going to be the main ingredient in most of our local vaginal hormones. You can get this as a vaginal cream. You draw it up in an applicator, you insert it in the vagina. If you're really struggling with vaginal dryness, then you can use it nightly for a couple of weeks and then reduce it to twice a week, and that would be your maintenance therapy, and you'd want to continue to use that, until you didn't care whether your vagina was dry. If you're 80 years old and you're not sexually active, you don't have any problems, maybe you don't want to be using it. But certainly if you are prone to urinary tract infections or you're having discomfort or you're using a pessary, then you'll want to continue using the cream. There's really no downside to it. There are also estradiol inserts, little capsules that you can place inside the vagina. Those are also very low dose. There are estradiol tablets that come in pre-filled applicators that you can use. That one has a generic. The estrogen cream also has a generic. And then there is a ring called Estring that's pretty cool. You put it in the vagina and you just leave it in there for 90 days and it releases estrogen that stays local to the vaginal tissues. That one doesn't have a generic. It's a little bit pricier, but I do have several patients that use this and they love it. It's just very, very convenient. All of these medications that I'm talking about are FDA approved medications. They are prescriptions that you get from your provider and you take it to your regular pharmacy or one of these other pharmacies I talked about, and you can get it filled. Then if you have certain special situations like irritation with regular FDA approved estrogen vaginal cream, then you can always consider a compounding pharmacy. Some of the benefits of compounding pharmacies are that you can get medications in a different type of cream or base that will not have as many ingredients. They can really try to put more soothing ingredients in there, especially if you're allergic to something that's in the pharmaceutical produced estrogen cream. And you can also get different types of hormones compounded. So if you need testosterone for the vaginal tissues because you haven't responded to estrogen, then you can get this compounded. And we do have testosterone receptors in our vagina, especially at the opening of the vagina, at the base of the bladder, in the urethra. And so some women will respond well to a combination of estrogen and testosterone. Then there are some other different local hormonal products that you can use. One of them is called Intrarosa. It's an adrenal hormone. It comes in a suppository. You use it nightly or daily. And your vaginal cells break it down into testosterone and estrogen that stays local in the vagina, breaks it down into estradiol. And that I find it works pretty well in women if they haven't responded to the estrogen. That's my second wave, my go-to after the generic estradiol cream or tablet. I like the tablets a lot because women report better compliance with them because they're not messy. They just put the tablet in, throw the applicator away. They're good to go. They don't have to use the cream. Cream can be messy. Obviously what goes in the vagina comes out of the vagina. And so a lot of women just find the cream to be a little more cumbersome and messy. Now there's also an oral medication called ospemifene, which is a SERM, a selective estrogen receptor modulator. It's an oral medication that you can take that acts like an estrogen in the vagina, but not in the other tissues of your body. So if you've tried vaginal medications and they haven't worked, or you have sensitive tissues and you haven't found something local that's non-irritating to you, you can always consider trying Ospina. Ospemifene is dosed daily, and there can be some increase in hot flashes and other symptoms such as that. So if you're really struggling with those, that may not be the best medication for you. Because ospemifene is an oral medication, it gets metabolized by the liver, and so it can interfere with certain medications. So you will want to check with your doctor about whether you're a candidate for using this. Additionally, there's a slight increased risk of blood clots and stroke, so make sure you speak with your physician about whether you're a candidate for this medication. My philosophy is generally to start with a local product first, and most of my patients are on board with that. And then if we don't have success, then we move on to other medications. Now, the other thing that happens a lot in my practice is I will prescribe a local vaginal hormone for a woman. And, I think this is happening less and less now that the word is getting out about menopause and hormone use, and women are starting to feel more comfortable that they're not going to get breast cancer or have some terrible side effect from hormones, and that hormones really can be beneficial for a lot of women. I'm seeing this less and less, but in the past, when I would prescribe a local vaginal estrogen, I would prescribe some estradiol cream or some estradiol tablets. My patient would go to the pharmacy and she would pick up the box, and then there in bold lettering on the box or on the insert, it would say, warning, this medication, this estrogen can cause breast cancer and stroke and blood clots and heart attack and uterine cancers. And they would say, nope, I'm not going to use that. Oh my gosh, that is terrible. Why would my doctor give me that? What they don't understand is that is a labeling for all estrogens. So unfortunately, the FDA does not distinguish on labeling these products between systemic hormones or systemic estrogen that you put in your entire body, which is a much higher dose that's going to treat things like hot flashes and night sweats, does not distinguish this from the itty bitty tiny little bit of estrogen that you are going to put in your vagina that's going to stay local. And so women frequently can be scared off by these medications, by these warnings. Now, when you listen to those drug ads on the TV and the commercials, and they list all of the possible side effects, how many times do you think, oh my gosh, just deal with the disease? Why are you going to take that medication if you can have all these life-threatening complications? But these are rare side effects for most medications, and same thing with vaginal estrogens and local vaginal hormones. Side effects or serious complications are going to be exceedingly rare. Now, the other thing that happens sometimes is a woman may opt to use a vaginal estrogen cream or estradiol vaginal cream, and I'll prescribe this to the pharmacy. And unfortunately, even a generic can be somewhat pricey. So she will go to the pharmacy and they'll say that tube is $60, which, that's pretty pricey. I get it, especially if, you're retired and you're on a fixed income. $60 for some cream that you put in your vagina seems excessive. But when you do the math, most women are going to use a gram of the medication twice a week, and each tube is going to have more than 40 grams. So that's going to be about 20 weeks of therapy, which is going to be 5 months plus or minus, depending on how much you can just squeeze out of that tube. So if you break down that $60 over 5 months, it's much more reasonable. And as I mentioned, more insurers are covering these products to a better extent, and there are other prescription discount cards that you can use, or like I said, discount pharmacies where you just pay out of pocket and it's going to be cheaper for you. A couple of other medications or options I haven't mentioned because I infrequently prescribe. The first one would be Premarin vaginal cream, which is a vaginal estrogen cream that has a combination of different types of estrogens in them. And these estrogens are from pregnant mare urine. Some women have heard of Premarin, Prempro. These are the medications that were studied in the Women's Health Initiative study. We really tend to go with a more body identical or bioidentical treatment regimen these days, but Premarin vaginal cream is approved to treat menopausal vaginal dryness and pain with intercourse, and it likely will work, but it doesn't have a generic. And again, I tend to stick with the more body identical estrogens and hormones. I discussed a little earlier about compounded medications, and some women will want to go with a very, very weak estrogen, or they will not be able to afford an FDA-approved vaginal hormone. And so sometimes we will compound an estradiol cream. So that means that I will write a prescription to a compounding pharmacy and they will make that on site in their own cream or base. And they are not regulated by the FDA, but I have a number of compounding pharmacies that I feel very comfortable with that I will prescribe to. And sometimes we will prescribe an estriol vaginal cream, which is going to be a weaker estrogen than estradiol. If a woman gets good benefit from this and it's affordable, she's having the effects that she wants, that's great. But a lot of times I'll find women coming in from other clinics or providers who have been using estriol vaginal cream and they just feel like it's not working, and they are frustrated because they feel like they're doing everything they're supposed to be doing and it's not working. And I just explained to them that this is a much weaker estrogen, and then we try a different therapy. So to recap, if you are having vaginal dryness, don't wait until it gets out of hand. Don't wait till it gets bad. Don't wait till it's been going on for 3 years and the dryness and the burning is excruciating and you can't have sex. Talk to your doctor. We know that the majority of perimenopausal and menopausal women can experience this symptom, but Very few women are talking to their provider about it, and there's nothing to be embarrassed about. And if you're not getting help from your provider, go see someone else. Go see a gynecologist. If you're working with your primary, go see a different gynecologist. You can also find resources on the North American Menopause Society's website to find certified menopause practitioners. If you go to menopause.org, you can find hopefully a provider in your area that feels comfortable treating these conditions. And like I said, there are very few cons to using these medications. They're very safe. They're going to stay local in the vagina. And with time and consistent use, they should produce results. Well, all right, ladies, I hope that you found this episode helpful. I am wondering how many times I said vagina or vaginal in this entire podcast. It's probably an astounding amount. But anyway, please like, subscribe, and share, and let me know if there are any topics that you would like me to cover. I look forward to hosting some guests in upcoming podcasts, so stay tuned for the GynoBits lineup. Thank you for joining me for today's GynoBits podcast. If you like this podcast, please like, subscribe, and share. Just a reminder that this is not medical advice and you should consult with your personal physician. Also, the opinions and views are mine only and do not reflect those of my employer. If you would like more information or to consult with me, please go to my webpage, healthiermenopause.com. You can also find me on Instagram at healthiermenopause and Facebook, MenopauseMD.